Disruption in emergency room and acute admission services at the Leader Hospital has been affecting local residents since last April, when temporary notices were in place. Then a full-out closure of these services by June. The center point of this issue has been a lack of physicians working in Leader. Now, several months later, and the Cypress Health Region is hoping to be one step closer in reopening these services at the Leader Hospital.
We have our third physician for Leader set to arrive at the beginning of March. And at this point, what we know is that this physician will be fully licensed on arrival in Saskatchewan, so that means there won't be a whole assessment process that this person needs to go through. Dr. Plongi, who is there and working, has completed his remediation work and submitted everything to be assessed. So we're optimistic that within the next little bit we will also receive word that he's fully licensed. And Dr. Hawk is going to be starting his remediation next week in Moose Jaw. So that will be up to a 12-week period of time where that remediation will occur. So we're becoming quite optimistic that we'll be opening up the hospital shortly in Leader. And when I say shortly, I mean that may be into, well into spring by the time we have our physicians in place.
Welcome news for town officials, who indicate the future of the town strongly depends on having full medical care in the community.
Well, it's going to give the town a little bit of insurance as to whether or not we're going to have a hospital or not. So a lot of people thought that it was the start of the closing of it, and we always tried to tell them it wasn't. So there were some very uncomfortable people because people who are looking at retiring may not retire in Leader if we don't have a hospital facility. So they'll move off to other areas. So it's very important that the hospital does stay open and active.
And as the Cypress Health Region works to restore full hospital services in Leader, Vachon adds that residents do have access to the local medical clinic for their general medical needs, with no major issues arising over the past several months during the disruption in hospital services.
I think things have been managed very, very well, either through our EMS or, the medical and clinical staff that are in the community during the day. But again, it's a community that has enough of a population and is in a geographical location that we know that we need to, have something in that area. So that's what we're going to work towards, is to get that back up and running and go from there.
The town of Leader has a population of 1,000 residents and is located 2 hours northwest of Swift Current.